remember, women are 52% of the global population. So it's not a niche market, which people have said to me in the past. Unless you're building the next different AI right now, we're not talking notes on a napkin. It needs to be research that's been conducted, and then we can start to get to personalized healthcare, to personalized preventative care, and really check the box on really good health and longevity.
Hi everyone, my name is Arham and I welcome you in another exciting episode of the Business Narrative. Today we have a health tech investor, a visionary entrepreneur. She has been working in health tech industry from last many years, and we will be going to discuss pivotal moment and spotting the opportunities in international and national market. She is none other than Fiona Thwaites. Fiona, thank you so much for your precious time.
Thank you so much for having me. I'm excited to have this conversation.
The pleasure is all mine. So I will directly jump into the first question, which is relevant to your entrepreneurial journey. So, what was the pivotal moment that inspired you to launch your own consulting firm? But before that, you were doing a full time job. So, like, what was the driving force behind it that forced you to launch your own consulting business?
No, great question. So it's not my first time being a fractional consultant or fractional employee, depending on what the current term is. I was in the world of consulting innovation and communications for a long time in the US, and spent periods of that time being a consultant, and then periods of that time being a full-time employee. What happened last year, I guess it was almost a year ago, so I had an exit from the women's health tech company that I was running, and I decided to be my own consultant again, or in this case, a fractional CMO, really to give me the space to try some different things for work as I'm figuring out the next full-time opportunity.
Okay, but you on the other side, we see you that you were consulting, you were giving your consultancy expertise to many startups, right? But why you decided that now you will going to invest in these health tech startups? Like, there was a certain motive that you will going to grow them with the help of money and with the help of your expertise, or like it was just a deliberate decision?
Great question. So I've been investing in small businesses / startups for a number of years. And I believe in giving people the opportunity to prove themselves. That was certainly my model when I first started investing in New York. I invested in 2 creative services companies, and they have been very successful. And they were struggling to get investment through any other means apart from angels. And that's really what I see today, especially in the health sector, and especially when you make that smaller into the women's health sector. Early stage companies really struggle to get funding, and I'm very fortunate to be able to be in a position to help companies who are at early stages write small tickets with a group of other angels who do the same, and that enables these really early stage startups to either build their first prototype, go through the first round of building a model and test it on consumers, to speak to consumers and do consumer research, and just help them get further on in the process and really validate their ideas and ideally get some initial customers.
Okay, so now do let me know, like, why do you think that fem industry is unfunded? And secondly, like, when any new CEO or founder is trying to pitch you an idea, have you set any parameters that these are the parameters if this particular idea or business startup will going to fulfill the requirements? Now I will going to invest in this particular startup. Have you set any parameters? Because every CEO, every entrepreneur, every college person who has been just graduated from university, he think that he has a very unique idea and he will be getting a lot of funding when he will going to pitch to VCs.
Let's start with your first question. So regarding why are women's health or femtech companies consistently underfunded? I think there's a challenge in the space of, I'm thinking traditional venture capital, where we haven't seen an extensive number of exits from women's health sector companies yet. It is slowly changing. There's starting to be some M&A happening within that sector, which I think is really positive. Do we have any unicorn exits yet? No, but we certainly have valuations towards that, which I will cite. In the UK, there's Flow, the period tracking app. In the US, there's a company called Maven, which is supporting women through their whole life journey with regards to reproductive health. I think what is a challenge, and that leads on from what I just said, right now, women's health tends to be focused on either periods, fertility, or other gynecological issues. What VCs really need to think about is actually women's health or conditions that really impact women also include neurodegenerative diseases, autoimmune diseases, mental health conditions, and cardiovascular disease. More women die of cardiovascular disease than they do of breast cancer, just as an anecdote for people. So I think we really need to consider diseases where traditionally we've maybe been treating men and women exactly the same. There's more research being done at the moment, particularly around sort of X and Y, how women react differently to certain different drugs, how diseases develop differently in men and women. And I think that that's increasingly going to show that, oh, there's a huge opportunity. Remember, women are 52% of the global population. So it's not a niche market, which people have said to me in the past. So I think it's changing, but obviously change takes a long time. But I think right now there's just some misperceptions and unknowns, right? The way that traditional VCs think about markets. And hopefully in the next 5 years or so, that's significantly going to change. So then your second part of that question is, what should founders sort of be storytelling, or what should they be thinking about when they are going to people for money? Not just VC, but I think angels as well. I think one of the most interesting things, so I'm speaking for myself personally, is when someone comes to me and they have a business idea that they've developed because they themselves had an issue. So let's think, a friend of mine, she was in the HR recruiting world, and she was finding certain parts of that process incredibly frustrating. And she decided to start a company because she believed that she could do it better. So someone who had deep knowledge of the existing industry, already had some network within that industry to potentially get people to try out her new product and service, and then also looks like a thought leader in that space because of the personal branding and profile that she built. So I turn that lens when I'm looking at women's health companies that I'm potentially going to invest in. What problem are you solving, aka what problem you yourself did you have that's inspired you to start this business? How and why are you an expert, and how and why is your network going to help you grow your business? And when someone's pitching to me, even if it's for early stage funding, I really want to see that they've done more than just an idea. Like, unless you're building the next OpenAI right now, we're not talking notes on a napkin. It needs to be research that's been conducted, even if it's family and friends to start. Will you buy my service, my product, my whatever it is, and have an understanding of the jobs to be done that you're trying to solve for that particular problem?
ChatGPT, AI, and all these robotic technologies are booming on daily basis, and people, they are expert of these fields. They are saying this that these technologies will going to take over in near future. This is a reality in health sector as well, because I cannot imagine like a robot will be doing operations in near future. How will health sector will look in next 10 years?
So I think in the world of healthcare, AI has done amazing things already in being able to, for example, transcribe notes from when you see the doctor, right? Make it easier to fulfill certain prescriptions, get blood tests, analysis of tests, and so on, that wasn't there in the past. And it could have taken days to get blood work results back, where now it can take hours. I'm not saying that you don't need a human in the loop, especially at the moment. Remember, these models are still really early. They still have reasonably small data sets to go on. So if you're trying to understand, do I have a vitamin D deficiency or not, there needs to be a really huge data set in the background that's kind of churning through all the data to make sure that the yes or no answer is validated, right? In terms of the doctor, I think with all of the telehealth that we have, obviously COVID saw a huge surge in telehealth providers. I think they are certainly being augmented today with LLM models in the background. I think there are amazing tools out there that are leveraging those models and creating agents that are what we sort of say in health are enabling a first line of defense, right? So the person either calls or texts or voice notes an agent and can have an initial conversation. And that actually helps that person then get into the system, get the tests they need, and get through the system faster, potentially than they would if they were just calling a practice, had to make an appointment that might be 3 weeks later, had to then wait 3 weeks longer for tests and so on. So I think there's definitely some efficiencies that AI is creating. Will AI start to do operations? I'm not sure. There's already robots, right, that already exist that are conducting some operations that surgeons used to conduct. I think that will continue to evolve. And again, I'm not saying heart transplants are going to be conducted by an AI functioning robot, but I do think some more basic procedures can certainly be expected to be done by robots fueled by LLMs in the not too distant future. And then I think for me personally, the exciting thing that's coming with AI is the ability to coalesce all of the disparate data points, right? So as I'm sure you know, and many of your listeners know, healthcare data tends to sit in silos. So you have your doctor's data set here, the consultant's data set here, my own wearables data and tracking that I'm doing over here. And it's still really clunky to get all of those data points to connect and be able to show the whole picture of my health. That to me is one of the most exciting things that I see generative AI is going to be able to do. And then we can start to get to personalized healthcare, to personalized preventative care, and really check the box on really good health and longevity, right? So as we kind of all know the data, everyone wants to be in good health for longer. We don't just want to live for longer, we also want to be in good health. And I do think that AI tools will be able to help us live healthier, longer lives.
So now I will going to detrack you a little bit because we have a surprise rapid fire round. I will going to ask you some rapid fire questions and you have to answer them very quickly. Tea or coffee?
Tea.
Morning bird or night owl?
Oh, night owl. I'm trying to be a morning owl, but I do prefer the night.
Okay. Any secret talent that nobody knows about yourself?
I don't think so. I'm pretty good at tennis.
Any fictional character that you want to play in your real life?
I would love to be Lara Croft. Who wouldn't?
And lastly, any decision in the past you regret?
The one decision that maybe I wish I could change, I was traveling in South America a long time ago, and I got the opportunity to stay and run a surf hostel. And I do sometimes wonder what would have happened if I'd taken that opportunity. I didn't. I returned to the US and was at a ski bum for a ski season instead. But yeah, that's really the only decision that I took, that I do sometimes wonder what would have happened if I'd said yes.
So this is the end of a rapid fire round. So we had a lot of things to discuss, but we have a time limit. But before leaving, any message for aspiring entrepreneurs, those people who are juggling around, they are trying to do something in their life, but they're continuously failing. Any message, Fiona, from your past experience you want to give to all of them?
Sure. So I think the juggling around and not getting success, I think it's critical to focus, and it's also critical to step back. And you may think that you're not being successful, but I bet you are making progress, right? And being able to have a clear plan as to the next one step that you can take to make a difference in your business. I think just clarity is really important. The excitement that I have for the future in health is the coming together of all the different data points. And I know it's not going to happen overnight, and I'm not a very patient person, so I try and moderate my excitement. But I do believe that ultimately we will have a blockchain solution that I, the individual, can take control of all of my healthcare data, sports data, physical test data, that everything will be able to come together, and I will be able to, through AI and generative intelligence, be able to understand what I should be eating at what time, and what exercise I should be doing, and what checks and tests I should be doing on a year on basis, so that I can live to the max and have the healthiest longevity that's possible.
So thank you so much for your kind words, and I hope all the viewers will going to like the podcast. If you like the podcast, do subscribe the channel and press the bell icon. We will be going to meet you in the next podcast with another exciting guest. Till then, keep daring and keep achieving and keep listening to the business narrative.